Question number 9.
Brian's cirrhosis got worse and is not tolerating protein well, as evidenced by abnormal laboratory values. Nurse Mimi anticipates that which of the following medications will be prescribed for the client. A. Ethicrinic acid, Edicrin. B. Lactulose, Chronolac. C. Folic acid, Folvite. D. Thiamine, vitamin B1. The correct answer is letter B. Lactulose, Chronolac. Administration of lactulose aids in the clearance of ammonia in the gastrointestinal tract, thus decreasing the amount of ammonia in the blood since clients with cirrhosis have impaired ability to metabolize protein.
Question number 10.
Nurse Mimi is caring for Brian, who was diagnosed with liver cirrhosis. Which assessment findings indicate that Brian has deficient vitamin K absorption caused by this hepatic disease? A. Ascites and orthopnea. B. Purpura and peteke. C. Dyspnea and fatigue. D. Gynecomastia and testicular atrophy. The correct answer is letter B. Purpura and peteke. A hepatic disorder such as cirrhosis may disrupt the liver's normal use of vitamin K to produce prothrombin, which is a clotting factor. Therefore, small blood vessels leak blood under the skin, causing purpura. Peteke are small, 1 to 3 mm, red, non-blanching macular lesions, while purpura are larger, measuring between 4 and 10 mm in diameter. Consequently, the nurse should monitor the client for signs of bleeding.
Question number 11.
Nurse Mimi is completing an assessment to Brian, who was diagnosed with cirrhosis. Which of the following nursing assessment is important to notify the physician? A. Expanding ecchymosis. B. Ascites and serum albumin of 3.2 grams per deciliter. C. Slurred speech. D. Hematocrit of 37% and hemoglobin of 12 grams per deciliter. The correct answer is letter A. Expanding ecchymosis. Clients with cirrhosis have already coagulation due to thrombocytopenia and vitamin K deficiency. This could be a sign of bleeding, which may lead to shock. The normal albumin level is 3.5 to 5.0 grams per deciliter. A slight below normal level can be treated with long-term process. Slurred speech is characterized by the poor pronunciation of words, mumbling, or a change in speed, making it difficult to understand, and can be treated long-term. The normal hematocrit for men is 40 to 54%, while hemoglobin ranges from 13.8 to 17.2 grams per deciliter, though below normal level. This is not as urgent as bleeding.
Question number 12.
Brian, who has a history of cirrhosis and alcoholism, was admitted with severe dyspnea resulted to ascites. Nurse Mimi is aware that the ascites is most likely the result of increased blank. A. Pressure in the portal vein. B. Production of serum albumin. C. Secretion of bile salts. D. Interstitial osmotic pressure. The correct answer is letter A. Pressure in the portal vein. Enlarged cirrhotic liver blocks the flow of blood in the portal system, causing increased hydrostatic pressure plus less supply of albumin that holds water into the blood due to damaged liver, causes water to escape in the vascular system, leading to ascites.
Question number 13.
Brian developed esophageal varices. Nurse Mimi understands that the best explanation why patients with liver cirrhosis developed esophageal varices is which of the following? A. Chronic low serum protein levels result in inadequate tissue repair, allowing the esophageal wall to weaken. B. The enlarged liver presses on the diaphragm, which in turn presses on the esophageal wall, causing collapse of blood vessels into the esophageal lumen. C. Increased portal pressure causes some of the blood that normally circulates through the liver to be shunted to the esophageal vessels, increasing their pressure and causing varicosities. D. The enlarged liver displaces the esophagus toward the left, tearing the muscle layer of the esophageal blood vessels, which allows small aneurysms to form along the lower esophageal vessels. The correct answer is letter C. Esophageal varices are dilated submucosal distal esophageal veins connecting the portal and systemic circulations. Increased portal pressure causes some of the blood that normally circulates through the liver to be shunted to the esophageal vessels, increasing their pressure and causing varicosities.
Question number 14.
Brian developed different complications because of his liver cirrhosis. Nurse Mimi is aware that the most dangerous and life-threatening condition would be A. Esophageal varices, B. Ascites, C. Peripheral edema, D. Asterixis. The correct answer is letter A. Esophageal varices. When a client has esophageal varices, the vessels become very fragile and massive hemorrhage can occur. This can lead to shock, leading to 30 to 50% mortality rate. Question number 15. A Sengstaken-Blakemore tube is inserted in Brian's upper GI in the effort to stop the bleeding of esophageal varices. Upon insertion of the tube, the client complains of difficulty breathing. The first action of the nurse is to A. Monitor vital signs, B. Deflate the esophageal balloon, C. Encourage him to take deep breaths, D. Place a pillow on Brian's stomach area. The correct answer is letter B. Deflate the esophageal balloon. A Sengstaken-Blakemore tube is a red tube used to stop bleeding from the esophagus and stomach by inflating a balloon tamponade. In case the patient develops difficulty in breathing, it means the tube is displaced and the inflated balloon is in the oropharynx, causing airway obstruction, so the nurse should immediately deflate the balloon. Question number 16. Brian, who was diagnosed with cirrhosis, is complaining of belly pain, itchiness, and his breasts are getting larger and also the abdomen. The client is so upset because of the discomfort and asks the nurse why his breast and abdomen are getting larger. Which of the following is the appropriate first response of Nurse Mimi? A. How much of difference have you noticed? B. It's part of the swelling your body is experiencing. C. It's probably because you have been less physically active. D. Your liver is not destroying estrogen hormones that all men produce. The correct answer is letter A. The first priority response should be an assessment. Asking how much difference have you noticed allows the client to elaborate his concern and provides the nurse a baseline of assessment. Question number 17. Together with other patients with liver cirrhosis, Brian observed a 55-year-old male developed enlarged breast tissue. You explain to the patient that this is happening because A. The liver cells are removing too much estrogen from the body, which causes the testicles to produce excessive amounts of estrogen. B. The liver is producing too much estrogen due to the damage to the liver cells, which causes the level to increase in the body. C. The liver cells are failing to recycle estrogen into testosterone. D. The liver cells are failing to remove the hormone estrogen properly from the body. The correct answer is letter D. The liver is the primary site of estrogen metabolism. Therefore, a damage in the liver would lead to failure of removal hormone estrogen from the body, which leads to gynecomastia. How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.